Hey guys, welcome back for another 5-minute EMS review where we give you short and to the point videos on different EMS topics. Today, it's the EMS medication acetaminophen. Let's get started. Acetaminophen, perhaps better known by the brand name Tylenol, is a para-aminophenol derivative. And this one is a fairly simple medication for us to use due to the simplicity of its use for us in EMS. However, at the same time, it's a little bit complicated because, as we'll see here in a minute, the mechanism of action for acetaminophen is not 100% understood. So we'll get to that in a minute. First, let's remind ourselves that acetaminophen is classified as a non-opioid analgesic or pain reliever that is not narcotic in nature. And it is also classified as an anti-pyretic or fever reducer. So because of this, you will most likely see it appear in both pain control and fever protocols. So you'll see uses available for both of those functions. Now, as we said earlier, its mechanism of action is not 100% understood. As for the analgesic effects or the pain control effects, among other things, it's thought to be due to the inhibition of the enzyme cyclooxygenase. And what cyclooxygenase does for us is it is involved in the formation of prostaglandins. And so it's through the blocking of the enzyme cyclooxygenase where we can then in turn inhibit the formation of prostaglandins. And that is where one of the ways in which acetaminophen is thought to help us with our analgesic effects. Now, in addition, we said that it is anti-pyretic. It has anti-fever properties. So the mechanism of action there is also through the blocking of the formation of prostaglandins in the central nervous system, but it also has a feature where the medication helps to block pyrogens or fever-producing substances at the hypothalamus in the brain. So again, fever control and pain control for us. Now, unlike aspirin, which has some antiplatelet characteristics, Tylenol really does not have any significant antiplatelet characteristics for us. So we're not going to see it used in our cardiac protocols like we would see aspirin. In addition, it is not a significant anti-inflammatory drug either. So just a few caveats there. Now, some cautions. Acetaminophen can be toxic to the liver at high enough doses. So we want to avoid giving it to patients who have chronic liver disease. And we also want to avoid giving it to alcoholics because of the effect of the long-term alcohol use on the patient's liver. Now, there is an overdose antidote for acetaminophen called acetylcysteine or Mucomyst. So that is something that should be available at the hospital if it is a large enough overdose of acetaminophen and the hospital deems the circumstances fitting to use that antidote. So just be aware that there is an available antidote for acetaminophen in an overdose situation. Now, for us in EMS, doses are going to vary. Make sure you consult your local protocol. Typically, we're seeing a basic dose range for adults around 325 to 650 milligrams PO. Now, we also are going to have Tylenol available in the pediatric population as well, usually in a liquid format or perhaps in somewhat older children still in that PO medication route. And that is usually in 15 milligrams of acetaminophen per kilogram of body weight. So that would be our pediatric dose. Now, we also do have acetaminophen available in an IV and a rectal suppository form, and as well as we already mentioned the children's liquid forms. So be on the lookout in your local EMS agency and local hospitals for how exactly that medication is supplied. And that does it for us today for acetaminophen. I hope this helped unpack it a little bit for you. If you've enjoyed our channel, we would love it if you would share it with other colleagues and EMS students who may find it useful. And stay tuned for future videos. We do have a playlist on our YouTube channel that is covering all of the different EMS medications for us. So if you'd like to dig into some other EMS medications, be sure to check that playlist out. Thanks for tuning in, and we'll see you next time.